Most people think yeast infection is only a woman's problem, but let me shock you, men get it too. If you have ever had itching, burning sensations, strange discharge, this video might just save you. Not everything is gonorrhea or staphylococcus. I'm going to explain how that can happen and how to know if you have yeast infection as a man. We will also talk about the solution to it. Let's get into it. Yeast is an infection that is caused by fungi, a fungus called candida. It is common knowledge that women have yeast infections, but did you know before now that it can also happen to men? Let me know in the comments. In women, yeast is called candida albicans and it causes a cheesy and milky whitish discharge that is sometimes accompanied with itching, or sometimes it occurs without itching, or sometimes it occurs as only itching without abnormal discharge. But in men, on the other hand, it is called candida balanitis. And the first question is this: how will you know if you have yeast infection as a man? You will know you have yeast infection as a man if you notice pain, swelling, redness in your groin, burning, itching and irritation around the head of your penis, that is the glans penis, and under your foreskin if you are uncircumcised. There may also be thick white discharge that resembles cottage cheese, just like in women. There could be foul smelling discharge, and in uncircumcised men there will be difficulty in pulling back your foreskin. You may also notice shiny sores or blisters and peeling or flaking on your penis. If you have any combination of these symptoms, you likely have yeast infection, and the surest way to know is by running a swab MCS test. How can a man get yeast infection, you ask? You can contact yeast infection from having unprotected sex with someone who has yeast infection. This particular point is a no-brainer. I mean, it goes without saying, right? In that case, your sexual partner has to be properly treated, and yourself too. 2. The type of boxer and underwear you use as a man can predispose you to yeast overgrowth. We have a community of microorganisms on our skin, and this includes yeast. Yeast loves moist environment. As much as you love wearing that condom boxers, as you guys call it, which is spandex material, and you know it fits so snugly, right? It is actually preventing adequate ventilation in your groin area. This makes the place moist and warm and serves as a breeding ground for yeast on your skin to begin to overgrow, thereby causing you infection. What you can do is to choose boxers which is made of cotton material, basically breathable material. And if you've gotten any value from this video so far, please leave a like and a comment to enable YouTube show this video to more people who need to hear this. Also subscribe to the channel if you haven't done so that you don't miss more valuable videos like this. Number 3 causes poor hygiene, such as reusing your boxer over and over again. It causes your underwear to become the reservoir of the yeast infection. To prevent this, use clean boxers. I mean, try and change your boxers every day. No need to reuse that boxers you used yesterday. Some men think that it's only women who need to be hygienic with their underwear, but men too have something at stake if they aren't hygienic with their underwear. Number 4 cause is prolonged antibiotic usage. Antibacterials actually clear out not just the bad bacteria, they also clear out the good bacteria, which you need to keep the yeast from overgrowing, and this leads to yeast infections in both men and women. This is also why you need to stop the practice of taking ambiclous bicham after unprotected sex in an attempt to try and prevent infections. Certain illnesses make men more prone to having yeast infections. Illnesses that reduce the strength of your immune system, like HIV. Diabetes too leads to higher chances of having yeast infections because the presence of glucose in bodily fluids and in urine provides food for the yeast to overgrow. Some diabetic patients also have lower immunity, which makes it an even more ideal environment for yeast to grow. So you need to ensure that your sugar level is controlled as a man. Ensure that you always check your blood sugar. The use of antiseptic liquids and antiseptic soaps also predispose men to having yeast, not just women. You also need to ensure that you wash off the soap thoroughly from your penis with water after bathing. This next point is a strong point. Uncircumcised men. Uncircumcised men tend to have more yeast infection than circumcised men, and this is because in uncircumcised men, their foreskin folds. The foreskin of the penis tends to fold and harbors yeast cells, and that environment is perfect breeding ground for yeast to overgrow and thrive. The solution is that as an uncircumcised man, your hygiene needs to be top notch. You need to ensure you change your underwear more frequently. You should also avoid harsh soaps and dry your penis. Leave no moisture there. Choose breathable boxers or materials that ensure proper ventilation and dryness. This will limit the yeast growth. Now let's go to the solution. You can treat yeast infections with various antifungal medications, which are over-the-counter medications. These include ketoconazole creams, which you can apply twice daily after bathing and after changing your boxers. You can use fluconazole as prescribed by your health practitioner. You can also use ketoconazole tablets as prescribed by your health practitioner. Do not go ahead and self-medicate, and don't forget that the surest way for you to know if it is yeast and not gonorrhea, not staphylococcus or any other common infection is by running a swab MCS. Don't forget to subscribe to the channel, like this video, leave a comment in the comment section, and see you on the next one.